I want to thank Assemblywoman Laurie Davies and her team for putting this powerful night of education and awareness together for our community. And I want to thank our community partners, including Sheriff Don Barnes, for being here. We as a school district spend millions of dollars every year providing social emotional supports to our young people. In 2015, we were one of the first school districts in the state to invest money into hiring counselors for each elementary school in our district. In addition to the counselors we have in middle and high school, we have 33 in all of our elementary schools. Our priority is to provide support at an early age, intervene when necessary, and keep our young people on the right track, healthy, happy, and successful, because this leads to the best long-term outcomes for our children. We continue to work to lower substance abuse, provide greater connection to school and community, and provide interventions that are right for each individual child to keep them on the right track socially, emotionally, and academically. This year, we've invested in additional counselors to lower the counselor to student ratio from nearly 1,000 to 1 to 450 to 1. Last year, we were one of the first and the largest school districts in the state of California to open our classrooms. We knew that the best place for our students was in the classroom, and we opened in September and stayed open all year, even during the worst of the pandemic in January and February. We did this while keeping our students and staff safe, and because we knew it was the best way to support the mental health of our students and to support working families. I'm proud of our work, I'm proud of our team, and we'll continue to identify ways to prioritize mental health. Thank you all for your partnership and support. And again, welcome to Lisa Nagel High School.
It is with great pleasure that I get to introduce a local hero and my friend, Orange County Sheriff Don Barnes.
Thank you very much. It's my honor to be here, and I want to first thank Assemblywoman Davies for organizing this and working with us. But I really want to thank those in attendance and watching online, the parents and their children who are recognizing the importance of this very, very difficult topic. And it's not easy to have these conversations, but these conversations need to be had. We are learning way too often about the issues that our kids are facing, the pressures they're facing, and more importantly, what they're being exposed to on the narcotics trade. And I can tell you firsthand knowledge with my experience and your representative, and many local issues to deal with: national security, border security, narcotics trafficking, all the initiatives that we have. We have 6 different narcotics programs just in the Sheriff's Department that you may or may not be aware of. We have 2 street teams, dual narcotics teams. Many local law enforcement agencies have stopped their narcotics enforcement at the street level. We have not. We still have a very robust presence on the streets. You may not know this, but we have a western border. It's the Pacific Ocean. We take on the mission for the federal government to patrol our western border on the ocean ways and intercept pleasure craft and ponga boats bringing narcotics in through our harbors and even onto our beaches at times. We have a highway interdiction team. If you ever go down San Diego at the choke point where the checkpoint is, there's deputy sheriffs working there that are getting narcotics coming north on the highways and money and guns going south back to the border as well. We have a majors team, part of the high intensity drug trafficking area that is responsible for cartels and major drug trafficking organizations. We have stopped at nothing, including a parcel interdiction team that gets parcels coming in and out of John Wayne Airport that are carrying narcotics through those ways. And I can tell you that it's not getting better, it's getting much worse. All of our drugs being trafficked across the border have increased exponentially, and the one that I'm most frightened about is fentanyl. We have taken an approach on fentanyl, been ringing the bell on fentanyl, trying to get national attention and warning people about the risks of fentanyl. It's cheaper to produce, easier to traffic. We've seen an increase exponentially across the border. Our Orange County Crime Lab, internationally accredited crime lab, was the first crime lab to recognize the presence of fentanyl west of the Mississippi about 7 years ago. And seeing how that was going to impact our communities, we put in place a naloxone program with our deputy sheriffs. Naloxone is an opioid antagonist. It reverses the effects of opioid poisoning and can bring people literally back to life. We've had hundreds of saves because of our naloxone program. In 2016, I sponsored legislation that was carried, and I testified in the Public Safety Committee in the Senate about the presence of fentanyl and the risk that it presents to our community, specifically about fentanyl trafficking and fentanyl poisoning. It's not an overdose. Our young adults and children are consuming what they believe oftentimes are pharmaceutical quality pills that are not pharmaceutically produced. They're clandestine produced south of the border to look like Xanax and OxyContin and oxycodone. There's no pharmaceutical qualities in any of those pills. They're pure fentanyl. That's the only intoxicant quality in there is fentanyl. And now we're seeing fentanyl-laced marijuana being presented that will potentially overdose and kill our kids. When I testified in 2016 in the Public Safety Committee in the Senate, a member of that committee looked at me and said, the legislation we were proposing was to treat fentanyl enhancements for trafficking by weight the same as cocaine, methamphetamine, and heroin. And I was told by a member of that Public Safety Committee, 2016, just 5 years ago, this is absolutely not necessary. Fentanyl is always trafficked mixed with some other narcotic, and nobody is dying because of fentanyl. We've seen a 1,100% increase in fentanyl-related deaths in the 5-year period, 1,600% increase in the state because of fentanyl. And just in the Orange County Sheriff's Department alone, we have seized over 388 pounds of pure fentanyl. The number goes up every year, and we're on track this year to double our fentanyl-related deaths all over again. By the way, that fentanyl we seized is 88 million doses with tens of millions of dollars of street value in fentanyl. We have an issue. If it wasn't for COVID-19, we would be noticing things, but we're being distracted by COVID. This is the biggest epidemic we have seen from a drug crisis in my 33 years of experience in law enforcement, and we need to make sure that we are paying attention to these things. To the parents here, thank you very much. And those watching online, I want to thank you for taking the time to pay attention to this issue. I will leave you with one last thing, and this is very important. Does anybody remember what the Fourth Amendment is? The Fourth Amendment has to deal with unreasonable search and seizure for the government, right? Parents, the Fourth Amendment does not apply to you. Get in your kids' stuff. Get in their phones, know who their friends are. I was just talking to Jody out front a little bit ago about how easy it is to access narcotics. You can go on Snapchat, order up pills, have it delivered to your house just like a pizza. They call it Drug Hub. Ordering drugs, having it delivered, and oftentimes kids will have no idea what they're consuming. It's a high-risk environment. I want to thank again the school for hosting this, Capital Strong Unified for making sure that this is a very important message that you get to hear. You have great speakers that are going to share their experiences. And fortunately, somebody I consider a good friend today, Amy Neville, is going to share an experience that I hope none of you ever have to deal with. And some of you I know in the room have dealt with some of these losses. If you don't know somebody impacted by fentanyl, it's because you don't know somebody yet. It is that prolific. Please share the message you hear today. Talk to your friends, educate your neighbors, other parents, because this is a pandemic that is taking our young adults and kids from us and needs to be stopped. We are on the forefront. We're going to fight the fight, but we need a posse. I'm asking you to be my posse and start sharing the message of how fentanyl impacts our young adults. And there's never a time more than now that we need to make sure we share this message. Thank you for attending. I appreciate you being here and your support.